we're standing by to speak with the outgoing head of the Southern DHB, Chris Fleming. I think he's on the line now, so let's cross to him. Hey, good afternoon, Chris.
Kia ora, Leanne. How are you?
Kia ora. Thanks a million for your time today. I'm well, thanks. I was just saying that it wouldn't have been the easiest tenure in this top job in these difficult times. How are you feeling now that you're heading away from this high-profile job?
Oh, look, probably a mixture of jubilation for the new challenges that I'm going to face, but also a level of regret, because I think we're on the cusp of some exciting changes in Southern. And it will be a bit sad to not see some of the things that we've put in place come to fruition.
Yes, understand. However, you had some quite strong things to say last week, particularly about meeting needs that aren't being met currently, and saying that perhaps it's not about the budget; it's about actually delivering on the healthcare front. Where are we failing the most at the moment in the South?
Look, I think we've got a multitude of challenges. Certainly the shortage of nursing workforce is having a dramatic impact on hospitals, on aged residential care, on primary care, right across the system. That is probably the most significant constraint on our system at the moment in terms of delivering the services that we've got the financial resources to do. But we also, the lack of capital investment into facility development over the last, probably over the last 30 years right across the country, has led to situations like we have at Dunedin Hospital, which, frankly should have been replaced at least a decade ago.
Absolutely.
And even in the Southland Hospital, which we were talking at the board meeting last week, when Southland Hospital was redeveloped and it was reopened in 2004, it was predicated on the population of Southland, Invercargill and Southland reducing, and that isn't what's happened, and we just haven't really had the capital resources to keep pace with the demographic changes.
Yes, and it is particularly sad hearing of all the struggles going on in Dunedin right now. You hear reports of nurses crying in corridors. How distressing, how difficult for staff, and of course they're going to be hit by the flu bugs just like the rest of us. They're not superhuman, especially if they're under stress. People are going to get sick on the management and staff side of things, and then you can't be of any help to anyone.
Yeah, and look, that's the nursing workforce has hit the perfect storm. For a long time the NZNO has been advocating for safe staffing across hospitals across our country, and we've really committed to that. But it's occurred at the time that the borders are shut, immigration has been tight, and the available workforce has been very limited. And I hear numbers of between 4,000 to 5,000 nurses short across our country right now. We
say that number again, Chris. Sorry, how many?
There's between 4,000 to 5,000 nursing vacancies across the country. So that's both in DHB hospitals, but it's also in aged care and mental health NGO providers, etc. So 4,000 to 5,000 nurses is what we need, and is what we've got the resources. We've got the financial resources to achieve, but we just don't have the workforce.
So we're not getting them because we're losing staff? Like, where's the aggressive sort of campaigns to get people to sign up?
Oh, look, there's growing focus on that. Recently there's been the ICU critical care campaign, but I know that my colleagues nationally are implementing a wider recruitment campaign and process. The pay equity claims that are currently being worked through, the pay parity issues outside of the hospitals that also needs to be addressed. But we also need to increase the number of nurses that we're putting through our educational institutes.
Right.
I calculated in Southern, in the last 2 years, my DHB has needed to recruit 580 nurses to cover the safe staffing requirements and the natural turnover that occurs. And if we take 70% of all graduates from the Otago Polytech and the Southern Institute of Technology. That gets us, over 2 years, that gets us about 280. So where do the other 300 come from? We're not training enough in our country.
Right. And do you think there's a general lack of interest? I mean, do you think people are put off from a young age? Perhaps say there's there are people in school, and you're always at that age where you're like, what am I going to do? Well, my passion is nursing, but I'm so terrified to work in the health service because it's failing us right now, or it can't pay me what I want, etc., etc. Are all these factors? Is that where it's all starting?
Well, look, I do worry about the mushrooming effect in terms of the short staff or the shortage of staff is creating pressure, which in turn creates negativity in terms of the outlook. Once the pay equity claim is settled, nursing wages will be pretty attractive in terms of as a viable career pathway. I think we need to put the energy and the effort into revitalising the growth of that workforce, and not assume that we can always rely on importing the workforce from overseas. We will always get some of our workforce from offshore, but we need to be training enough of them internally.
And I know that you were saying to staff, don't be disheartened, keep pressing for change. But I wonder if staff feel they're ever being heard, and whether they're just frustrated and don't want to talk about any issues with anyone.
Well, look, I think staff do realise that we're trying as much as we can. There's significant investment by the Crown into the new Dunedin Hospital that's taking place right now. The calls for safe staffing have been heard and recognised. The resources are going in. It's about we're just in the perfect storm of coming off 2 years. 2 years living with COVID and the uncertainty, and of course our workforce is at the leading edge of that. And so the collective pressures have been immense. But look, I think the future structures, Health NZ, it's a really exciting time as long as we can get common sense into the capital planning, which I think Health New Zealand, through the health infrastructure unit that's been established, is getting runs on the board. And if we can tackle the longer term workforce shortage challenges, I think the future is bright.
Oh, you do? Okay, well, that's good.
I do.
Yes.
It's not going to be solved overnight.
Yes.
It's not going to, we're not going to be able to go, come, the end of September, it will all be resolved. It takes a longer term commitment than that. But I think we need to remain focused. We need to start to have some brave conversations. So, we were doing a master site planning for Southland Hospital. When it was redeveloped, it was the clinicians at the time voiced their concerns about the size, that it was too small.
Yes, yes.
And they even put it in writing. And actually, we didn't listen to that back then. And the assumption that population would reduce, has proven to be factually incorrect. We also need to think about where are we going in Queenstown, Wanaka, Central Otago, because by 2040, its population will be bigger than Invercargill, Southland. So what are we going to do from an infrastructure perspective there? And at the board meeting, there were conversations about going, we need to identify where that location for future service development in that region should be, so we can start talking about it now, because it takes a long time to develop and become a reality.
I hear you, and it's interesting you mentioned Southland, because it services such a big area, because Queenstown only has the private Southern Cross and the small Lakes District Hospital. So you've got Queenstown Lakes with all its busyness and all the tourists coming in, and then you've got Central Otago as well, all needing Southland Hospital to be ready, for for an influx of people, and Southland obviously can't really cope with that at the moment.
Yeah, well, and that is the perfect storm we're facing. We do currently have approvals to expand the ED and add an additional operating theatre. and there were 12 beds that were not commissioned in Southland Hospital that we have committed funding to commission. So, using the space that we can as effectively as we can, but that was the reason why we did the clinical needs assessment to ensure that as we do the inevitable expansion of Southland Hospital over the next decade, making sure we do it in the right way to not preclude major redevelopment, which is still quite a way away, but make sure we're using the land there in the most effective way so we can expand and major redevelopment in a logical way, which is something that we never did in Dunedin. We sold off the land in Dunedin that we had next to the hospital, and that landlocked it. And so hence you get the need to have a major redevelopment on a new site.
Absolutely. And poor Dunedin, they've gone through this issue with COVID and having to, not accept patients. Southland Hospital, where's it at the moment? So I know that you're saying there's not enough beds and not enough space, but is it coping okay through this twindemic, this flu-COVID combo?
Well, look, it changes every day between Dunedin and Southland in terms of where the pressures of COVID are. A couple of weeks ago, Southland Hospital was at the position that Dunedin Hospital is in as we speak. But look, I'm really proud of the way our staff are stepping up to the plate and addressing the challenges in the best way that we can in an imperfect system.
Yeah, and okay, it's hard not to get political here, but I'm just wondering why in New Zealand, we're supposedly a first world country, that things are quite so chronic. Like, why wasn't there enough foresight? Why have we got to this point? Because I swear that every time you read a newspaper or turn on the news now, there's some other really desperate situation with one of our hospitals. I mean, we're not, of course, up north isn't immune. Middlemore going through huge struggles. So. Who can we point? I mean, I suppose everyone wants someone to blame, but is it solely lack of spending, or is it just not? Have we just not thought about it enough? I don't know.
Oh, look. I think it is a symptom of a system that has been under significant funding pressure for a long time, and my DHB is a really good example. We have had persistent deficits for as long as there have been DHBs. And when there are persistent deficits, you naturally have to pull back your capital expenditure, just from a pure cash flow perspective. So I think it's the lack of longer-term capital planning and ring-fencing that, attempting to do capital planning 20 times over in a country of only 5 million people. This is where the Health New Zealand model and the Māori Health Authority, if it gets the teeth that it would appear to be being given, it should be able to do this in a much more methodical way and have some sort of common sense planning around future capital development rather than at times crisis responses.
Yeah, the ambulance at the bottom of the cliff cliche. And of course, Health New Zealand taking over in July. But you feel overall there are many positives to be taken from that?
Oh, look, I personally think the concept of Health New Zealand, and in particular the Māori Health Authority, this country, it's embarrassing in this country how very clearly the outcomes for Māori are so much worse than they are for European. And so if there's ever going to be a change, the Māori Health Authority having the authority and the resourcing to actually drive those changes, and the Health NZ having a structure around hospital planning, the tension in the system, and I'll be watching from a different role over the next couple of years, is how they can get traction whilst also building an organisation from ground up.
Right.
It's going to to go from a very small number of employees to 80,000 all overnight. There's a lot of work to be done until Health NZ is fully integrated and we're operating as a single body.
And Chris, personally, I guess you are very optimistic about your future. It must have been a really difficult position to hold at times during your tenure. Do you feel you will miss anything about this role?
Yeah, look, I talked to another reporter the other day, and one of the things perversely, one of the things that I think I will miss is actually where we've identified significant failings in the system, and Southern has had our share: urology, ophthalmology, colonoscopies. We've really tackled it and addressed the issues, and I actually, I feel. I apologise for the people for whom we have harmed, and look, I've spoken to a number of patients for whom there has been harm because of our failures, and it's just not acceptable. But actually, out of their plight has grown tangible improvements in our system, and I kind of really enjoy that we can actually fix issues and make the system better for our population. So perversely, I'll miss that, although the other side of me won't.
Absolutely not. Well, I do wish you all the very best for the future, Chris Fleming, Southern DHB Chief Executive, and it was a pleasure talking with you. Thank you so much.
Likewise. Take care.
Take
Bye.
care. Bye-bye.